AI and digital healthcare. We aim to convene a cross-sector community of academics, researchers, healthcare professionals, people from industry, to collectively advance regulatory science and responsible innovation for AI in healthcare. So thank you for joining us. My name's Jeff Hogg. I'm a clinician scientist at University Hospitals Birmingham NHS Foundation Trust, which hosts the incubator. And in these webinars, we use them as a kind of vehicle to surface challenges that different members of the community share with us around AI innovation, invite guest speakers in to explore that and bounce some ideas around together. Before we get stuck in with today's edition, though, just a few little housekeeping notes for those of you who are joining us for the first time. First thing to say is that we leave a generous slice for discussion and Q&A at the end of the session today. But please don't let that stop you typing away with any ideas you have as we go. You'll see at the bottom there's a little Q&A box and a chat as well for any comments. So if you get things down there, then we'll be able to bring those into conversation at the end today. I'll try and unmute you as well if Zoom allows me to get you to share your perspective. But if I know many of us may not be in a position where we have a mic or can speak, that means that I can speak to it too, which is great. The other note to make is that we'll be recording today's session. So if you've got colleagues that would have liked to join us, you can always signpost them towards the link or check back in later. And that's really all I have to say. So, as I mentioned, these webinars are demand-led, and we've had a number of contacts from people in a primary healthcare context asking about AI in their setting, and also growing interests generally in large language models and their use in healthcare. So it's fantastic to be able to have with us today Dr. Tafsir Ahmed, who's a medical doctor. He's a National Medical Director's Clinical Fellow to the Care Quality Commission, and he's leading a project entitled Perspectives on AI Use in General Practice, which should dig into all of these issues fantastically and start the conversation. So I don't think there's any more for me to say, and if you don't mind sharing screen, Taf, I'll hand over to you and get off camera and slip into the shadows. Thanks again. Oh, I think you may just still be on mute.
Hello. There we go.
Perfect. It was looking great. Thank you.
Thank you very much, Jeff, and thank you for the introduction and hosting this webinar as well. So welcome everyone. Good evening. My name is Taf, and I am the clinical fellow to the CQC, as Jeff pointed out. My background is also that I'm a resident doctor in East of England, and I'm going into general practice for training in East London next year. And in this interim period, this year out, I'm working under specifically the primary and community care team at the CQC, and I'm project lead with the honor of being project lead for this scoping perspectives on AI use in general practice in order to inform our CQC regulatory approach. So this is going to be the presentation itself. We'll go through for about 30 or so minutes. We'll have plenty of interaction, so get your Menti or Mentimeters ready, and then hopefully we can touch base on any Q&A and comments that come up for yourselves at the end of the presentation, and we can go through that. Brilliant. I'm just double checking. Can everyone hear me okay, Jeff? And see the screen okay? I think someone raised a hand, but
yeah, I can hear you loud and clear. It looks good. For raising hands, if you could just put a comment in the chat, then one of us can have a look on the back of our side, and if it's questions, we can dig into it at the end. Thanks a lot, Taf.
Brilliant, thank you, Jeff. Okay, so in terms of an overview of what we're going to go through today, we're going to go through the background of why is AI in general practice and primary care relevant right now, and a few stats and use cases there. Then we'll look at the project outline of my project specifically, just give you an idea of what we're looking at and been looking at CQC with stakeholders. And then hopefully we can talk about the preliminary themes that we've had from our perspectives and from the stakeholder perspective conversations that we've been holding with over 70 or 75% of our stakeholders already being interviewed or focus grouped, which has been great. And then, as we mentioned, we'll leave a large chunk to Q&A. And also, I think the most important aspect here is your perspectives in your roles and your thought process of AI in as either a healthcare professional or someone allied in the fields, as well as a patient, because we've all been patients ourselves. So we'll have a look at that. So to start things off, I wanted to look at mentee poll here. So what is your current role or job? Let's see if this works. There we are. So if you can submit some responses, and then we can have a look at answers. So if you scan the QR code there, or you go to menti.com and you use this code on the top, and then we'll see if some of the responses come in. Good. At UCL Best Uni, clinical fellow, brilliant to have some of my colleagues with me here. Digital navigator, very interesting. We can maybe have a look at that, and research, obviously research focused as well. We've got a few GP trainees. This is actually really hard to keep a hold of whilst it goes left and right and center. But no, this is brilliant. There's a good number of people here: pharmacist, clinical fellow, digital navigator, academic GPs, pharmacists, operations in health tech. Brilliant. Keep them coming. Keep them coming. It's good to have you guys all on board. This is like a very big MDT here that we have then, which is brilliant. And someone who looks into data protection, evaluation, professors, so academic focused as well, which is really good. So hopefully we can kind of balance between the two. And we've also got people from the product side as well, which is brilliant. These are all the stakeholders and the array that we'd like to have. Good. Okay, now I'm going to move on to the next question. And this is, what do you want to take away from this webinar? And obviously we'll have an option in the Q&A session to chuck any questions, but also it gives you a good idea to have intentionality from what you want to take away from this conversation. So I don't just talk to myself and talk about topics that might not be relevant. But yeah, I think that sounds good. Thank you guys for interacting. It's always good to have engagement. And hopefully it's 4 p.m. and hopefully towards the end of a working day, we can all kind of take it easy, but also take some good information in whilst doing this. Nothing to really push boundaries. Don't worry, I'm not talking about the background of AI, machine learning, and the use cases. That should be okay. Good, we'll keep them coming. I wish I had some like lo-fi hip hop beats at the background or something so that it could make this sound. I could keep that as a dull bass to this and not talk over. But yeah, okay, brilliant. So let me have a look at the responses. So what do you want to take away from this webinar? Examples and lessons learned, insights on AI for GPs, great. User perspectives, digital clinical safety, regulation, how to bring tech to GPs. And the biggest one being understand frontline use and what's being used right now. Insights for people using it and GPs and clinicians, examples, and current use of LLMs. Brilliant. Ideas of AI and how that can help. And the last question, and this one will be a quick one. What are the current uses of AI in GP or healthcare that you are aware of? You might have heard in the grapevine, you might have been reading in articles, it might have come up in LinkedIn, you might have used it yourself. So hopefully you've got some responses to that. Brilliant. Yes. Good. Triage and diagnosis management, admin management, scribes, triage. Good. Good. So people are aware of what's going on and things are out there already, clearly. Yes, Chat GPT, the most common use LLM, large language model, AVTS for transcription, as well as Heidi, kind of a few brand names out there. Brilliant. And yes, in the hospital side, radiology has taken up AI from a long time ago now, to be honest. And there's people are using it in chest X-rays to report simple things like that, but also frontline care in terms of CT heads being scanned and reported for those who have reported strokes, and that's been utilized at least for the last year or more. Ambient AI. All right, brilliant. Thank you for your input there. It looks like we've got a very decently knowledged audience, and I think that gives us an idea of where I can pitch this presentation. So in terms of defining AI, I've seen in the literature when you go through reports, everyone tries to define it in one way or another. Now, in this instance, we're going to define AI quite simply as a technology simulating human intelligence to perform complex tasks, and in this instance, in the domain of healthcare. All right, so we're just going to keep it nice and simple there. And I know there's more than one definition, but we'll go with that. And these AI systems can also be categorized as further to their definitions to conform with how AI is being used right now. And a few of the responses just before have already mentioned something that some of the use cases already. And one of the main use cases right now that we see in GP that have reported less kind of clinical risk is administrative efficiency and for administrative tasks. Now, the way that's being used is by automating and optimizing the back-end process, including things like staff rostering, so rota management, looking at appointment scheduling for the patients, looking at note-taking and AI scribes that were mentioned, like Heidi and Tortoise, just in the Menti poll just a second ago. And then that links into kind of from the note-taking, you can go through to transcribing consultations, to then filing them within electronic patient records and EPR systems. And then the next cycle of it is, as part of kind of the stream of information, you can use that information from the transcription to write letters for referrals and to patients, as well as mentioned, filing in the history and the EPR notes. And on top of that, we can use it for analyzing patient feedback that GPs might want for their own portfolio and other things like that. So patient summaries, note-taking, administrative efficiency, it looks like that's where it's being used, and uptake has gone up in 2024 the most, especially speaking to those anecdotally working in general practice at the moment. In terms of clinical decision making, this is where things become a little bit more kind of in the muddled and in the mix with regulation. So right now, some AI systems are used for diagnosis and treatment support and support of decision making for clinicians and doctors and in GP. Now, what they would do is help provide differentials and potential treatment options that a clinician can proceed with after taking on the information that's input. Right now, one way that it's used in a more basic level and kind of links to the administrative side as well is through GP reception use for triaging, kind of presenting complaints of patients that call in and or come through the door. And the way that that's being optimized is actually it's really hard for most of us to get through to our GP receptionists, especially over the phone. So now there's new ways of doing this, whether it's through a website or through an app. And now AI is being utilized at that front door to say, actually, do you have these symptoms? If you do, you should actually go to A&E right now or to the hospital or wait a couple of days for an appointment, or will be seen that day by a nurse specialist or a pharmacist specialist or a GP specialist. So they're starting to make those decisions at the front door. And in terms of kind of the more nitty-gritty aspect of medical care and GP care, we're looking at supporting decisions for prognosis of conditions, as well as looking at care pathways via these decision support systems. And as mentioned from our Menti poll just before, is that AI is already being used to report scans, and it's been used for this for over quite a few years. There's systems in the US and Australia that are more advanced than in the UK at the moment, and that technology is coming over. And that's for talking when we're talking about something simple as chest X-ray reports, and people in community, GP, A&E medicine are using services like that. Now, Then moving on to generative AI, and what we mean by that is large language models such as Chat GPT or Gemini being used. And in this context, it can be used kind of for either administrative tasks or clinical decision making. And so GPs or clinicians can go on to respond to patient queries that come through the door. Some GPs are using this to support their portfolio with generating letters, and RCGP has put out guidance regarding this, saying that it is possible, looking at reflections, writing up case notes, and as mentioned, some GPs are actually using this for diagnosis and treatment planning options as well as kind of their an easy access tool rather than going to Dr. Google, for example. However, to note, it does mention in ChatGPT's terms and conditions that that it should not be used in these instances. Now, I think I've exhausted talking about the uses in GP, but in terms of a wider context, we've also seen that AI is being used in patient interaction and support. And now these last 3 points aren't part of my project, and they're kind of outside of my scope because they go feed into more of the community and hospital side and more wider management side of things. But something that we should definitely be aware of, and something that will develop in the next year at the very least, if not already there. And as you know, with companies such as Google and Apple, their focus is really shifting towards the healthcare space. We're looking at, as you can see, a picture of an Apple Watch there. AI is being used in apps, in bots, as well as wearables to help deliver therapies, provide healthcare information to the patient, as well as supporting those patients in managing their maybe long-term condition as well. So hopefully improving access in that way. It's also been used in predictive modeling, kind of AI being used to predict potential missed appointments. So there might be a patient cohort that's higher, more likely to miss their appointment and DNA, which means do not attend. And what they would do is use the software to predict which of that list for the clinic that day, which patients are likely to not make it, and then those patients become flagged up. And then what can be done is reach out. People can call and reach out to ask them, actually, is there a way we can help you to make sure that you come to the appointment, and hopefully facilitate that response. And as mentioned, it's been also used for biomedical research as well as predictive modeling. So big pharma are using this for new drug and treatment discoveries, whilst predictive modeling such as forecasting staff needs, as we mentioned, but also quite importantly, looking at patient risk. And there are examples of use cases such as predicting a woman's 5-year risk of endometrial cancer, as well as AI systems looking at skin lesions and having a look at what the prognosis and predictive modeling behind that is as well. So that's just the wider context of AI use there. In terms of uses of who is using AI and how and the extent of it, there is some work out there at the moment, but there's not much at all. So the BMJ Healthcare Inform reported last year that 1 in 5 GPs use AI in their clinical practice, and ChatGPT is the most used of the LLM or AI systems there. And that was a sample of 1,000 GPs that were asked across England. And then a more recent study asked for by the GMC that was carried out by the Alan Turing Institute reported 1 in 4 doctors use AI in clinical practice. And of those 1 in 4 doctors, most of them use it at least weekly or monthly. So quite routine use of AI, and that went across the health sphere in terms of doctors that were asked. 929 was the sample there, and we'll come back to these studies in just a second. In terms of the wider context, AI is actually really important, and I think those in touch with current affairs might have seen Keir Starmer, our PM, talking about how he wants the UK to be the world leader of AI, or amongst one of the world leaders, with US and China kind of leading it already, and the UK really wanting to enter this space because there's real potential for growth, not only in the economy, but also for benefits for ordinary people and service users in this context, as well as patients. So right now, AI is implicated as a potential solution in the government's upcoming 10-year plan, with it being quite pivotal within the shift. So one way we're looking at it is going from analog to digital, but also another way we're looking at it is combining that with going from hospital to community. So you can see a lot more of these devices and technology coming to GP and community care. Actually, when speaking to Wes Streeting at the Health Select Committee, he was asked about what he thinks is the biggest thing that might change the NHS's course to hopefully benefit it, and he responded with digital health and AI. So clearly, it's at the forefront of everyone's mind, and Lord Darzi's 10-year report really honed that in as well. In terms of looking at it from a regulatory standpoint, ADAS is the Artificial Intelligence and Data Regulation Digital Regulation Service. And now that is a kind of a body that's been established since 2020, working in the last few years on the back end of things, looking at trying to get those AI devices and take them from market to being used safely in the NHS. The people pioneering it is the MHRA, of which we're quite aware of, regulates medical and medical digital health solutions, as well as in this group we've got CQC, where we look at the patient delivery side of things as well as the procurement side, kind of a bit of both, and that's quite a unique insight that we have, and hence why we are positioned as we are, as well as NICE. So although they're not a regulatory body, they look at standards, and they look at cost effectiveness, and work with us as well as the HRA and other allied regulators to make sure that we're bringing the right devices into the hands of our professionals and for patients. However, the one thing that we've realized, and quite naturally, is that we do lack the practical guidance on the uses of AI once we get to deploy them in the healthcare space. And as I say, it's natural because AI is only starting to come up in the last year or two quite profoundly. And here, I think, is our unique selling point almost as the CQC, but also a position that we've taken up where we need to be at the forefront of taking on perspectives of medical professionals, patients, stakeholders of AI being used in the clinical and patient pathway, and make sure that those views and perspectives are fed back to influence the uses of AI, as well as the regulatory approach of the bodies that I've mentioned. So as I mentioned, we've got quite a unique platform, and that's why we are here to kind of marry those two together. In terms of looking at the project itself that I'm leading, the project outline and the title being the scoping of the stakeholder perspectives in order to inform the regulatory approach. The project aims to develop our understanding of quality and how to support providers to improve by providing a better regulatory approach to AI use in GP, because at the moment it doesn't look like there's enough out there. In terms of CQC, we've got strategy priorities of trying to be more smarter and flexible as a regulator, ensuring patient safety and patient centered care is kind of at the core of what we do, as well as ensuring that we're trying to encourage innovation and not prevent it from happening. And in terms of our recovery priorities as an organization, we're aiming to re-establish trust, confidence, and credibility within our organization and with our stakeholders, because this is quite important work that we're doing in the sphere. In terms of the stakeholders involved, as you can see here, there's quite an array, and as a full disclaimer, as I mentioned, we're still in the middle of this study, so these are all preliminary findings. We haven't been able to speak to our GPs that we have under CQC, as well as the patient advocacy groups yet. And I think those are the two key stakeholders that we need to touch base with. So the other stakeholders that we have spoken to, apart from NHS England, primary care, who we're hoping to speak to in a couple of weeks, we have spoken to the ICB primary care directors, we've spoken to ICP digital leads of primary care. We've also obviously spoken to our allied regulators, but also professional bodies such as the BMA, the RCGP, the GMC, and others in terms of finding out where they are in terms of their position statements and their thoughts on AI and where they're situated right now to make sure that we are all aligning in the right direction or the same direction at the very least. In terms of healthcare AI developers, the unique part of this project is actually we want to speak to the medical AI devices that are out there. So we've spoken to Tortoise and Heidi already, as well as those already in the healthcare and GP space, such as EMIS, TPP, and System One. We've spoken to them regarding what they're worried about, as well as what they need from both regulation and a provider's point of view. And we hope to speak to Google and Microsoft in the coming months as well, especially because of their LLMs being so important in this sphere. So what we're trying to do is, as an organization, draw on the regulatory impact mechanisms that we have and the power to convene such stakeholders, because quite rarely would you be able to see the RCGP and the GMC sitting on the same table as the MHRA and HRA and NICE. And this is actually quite a nice way to get everyone together with a good aim in mind. And that's what we've been seeing in our conversations, which has been great. In terms of the actual outline of the project itself and where we are, so the aim is to use a questionnaire that will be coming out in a couple of weeks to GPs and practices. We've got more than 6,000 registered under CQC to look at the proportion of GPs using AI devices, what type of devices they're using and how they're using them, because actually there's nothing out there right now that lists these are all the devices being used in the NHS or in GP right now. So at least let's get a snapshot picture of where we are in 2025 with this. As I mentioned, stakeholder perspectives have been sought from focus groups and discussions, but our aim is to bring relevant stakeholders to a roundtable in March to kind of delve into the deeper key themes that we identify early on and that we'll be going through today, and then from there to evaluate those regulatory challenges and then see the touch points of actually we need stakeholders to work together on this aspect and see which organizations can have that conversation, dialogue, and facilitate that. In terms of our final recommendations from CQC, we want to be able to inform the relevant quality statements that we work with when we go to inspect services. We want to provide guidance and training to our inspectors to be aware of what's going on out there, because as healthcare professionals, it's already difficult as it is to find out what's going on, and the evolution of AI being used is quite widespread. And we want to make sure that our findings are in our annual state of care report, which will be published for national display, as well as a narrative under the innovation site for CQC to hopefully push the agenda a little bit more. So, talking about preliminary themes, we'll move on to that. So let's wake everyone up. As a patient, what are your thoughts on AI? And it'll be really key to get your perspectives, because we haven't spoken to patients yet, and we'll be speaking to advocacy groups in this instance. But what about yourself? We've all been patients before, most probably. What are your thoughts of AI? What are you worried about? What are you looking forward to? That's a great question. Good. Good. Okay, so the responses are just coming in. So, can my data be used against me? AI, what does it actually mean? There's a huge range of technology there. Can the NHS digital infrastructure handle it? That's a great question. We'll see if that can be looked at. Cautiously optimistic, fair enough. Clinicians might not know how to use it effectively. Sorry, nearly went all the way through it. Like to see it used to appointment transcription so I can get a copy of what was discussed. Good. So use cases, is it useful? Is there a loss of empathy? I want to be cited on the outputs. Good. So people want to be aware of what's being used and what's coming out on the other end, and is it accurate? So obviously yourselves here coming to an AI seminar, you'll be quite AI versed at least, so you probably looking at the more in-depth knowledge part of it as well. which is great. And I'll just group those responses before we go to the next question. Right comment. There we go. If you bear with. Okay. Fine. We might come back to this point with the group responses. In the meantime, what we'll do is, yeah, it's still loading. Well, what we'll do, we'll speak about perspectives of patients and healthcare professionals, and then we'll come back to what you'd mentioned as well. So, just bear with me. Here we are. So looking at the patient perspective, the most important groups, as mentioned, haven't been included yet. So for the sake of this webinar, what we're going to do is substitute that with the reports from the Alan Turing Institute, as well as the Health Foundation. The Health Foundation reported in 2024 about AI in healthcare. What do the public and NHS staff think? And that was a survey rolled out to more than 7,000 nationally representative members of the public, as well as over 1,000 staff members. Whilst the Alan Turing Institute looked at 1 in 4 doctors, actually it found that 1 in 4 doctors are using AI, with 929 being sampled, and then explored the perceptions and experiences, as well as the impact of AI on doctors. So there's not been many studies, as mentioned, looking at AI use in amongst doctors, medical professionals, hospitals, GPs in the UK. And I think we're at the forefront of that happening in the next year specifically. So we'll also be speaking about an BMJ article we mentioned earlier regarding the 1 in 5 doctors as well. And one more time, I'm going to try and see if that Menti has any options available, but I think there we go. It just took a bit of time to look through it. So looking at your responses, cautiously optimistic. Can the digital infrastructure handle it? Can the data be used against me? That's quite a sinister question. Very interesting. I'd like to see it used for GP transcription and a copy of it for what was discussed. Worried about clinicians maybe losing their expertise if they kind of they just rely on AI and losing that patient-centered care. That's echoed a lot from what's been found. Is it useful? Great question. Our question has always been zeros and ones. We're using it, but actually, what's the cost benefit analysis of it? What's the opportunity cost of using a different device that's not AI focused? Where is the AI data stored? Is it accurate? Is there loss of empathy? Again, mentioned here. Useful to streamline processes, trusting the algorithms and other instances. Brilliant. Thank you for your responses on them. It's brilliant to see, and we'll be going through them even in the Q&A as well, if not offline. So the Health Foundation. So on balance, the article mentioned that on balance, the public and NHS, both NHS staff, both support the use of AI, particularly for administrative tasks. However, less support for AI in direct patient care, with actually 1 in 6, though, are skeptical and don't think that AI will help at all in terms of improving patient care. And from the NHS staff perspective, we're looking at 1 in 10 that don't believe AI will help as well. So there is a diversion in opinion. And actually, when looking at the statistics, those that are younger, between 16 to 25, and women as well, are more skeptical than the other populations asked. In terms of the main concern, as you've mentioned in your in the poll just before, is the emphasizing the need for human connection and empathy with support for technologies that will enhance this. And we need to make sure that we support those technologies that would rather enhance this rather than take that away. There's also been concerns about AI making care feel less personal, worries about over reliance, as you guys mentioned as well, and desire to be informed of when AI is being used. So actually, what's been found in these reports are exactly some of the perspectives that you've come up with in the Menti poll. In terms of healthcare professionals, so similar to the public, many staff do worry about AI depersonalizing care, although majority do support AI use in patient care and look forward to using it actually. And in fact, most doctors are optimistic about using AI systems and are quite sad or disheartened by the fact that there's not enough AI opportunities being explored where AI can be utilized as well. Now, the admin burden is quite big in the NHS, and the administrative staff obviously would specifically want AI to be used for these instances, but also doctors feel that they have less chance of burning out when they can spend more time with their patients and work on more complex or challenging cases. However, there has been concerns on the flip side of that, and RCGP, the head of RCGP wrote a letter a couple of months ago, quite concerned about the potential increase in workload during implementation of new technologies, and we've seen that with electronic patient records in the past, where you duplicate work in the interim, and with the BMA as well, worried that actually without planning AI integrated into clinical pathways and work streams that are already existing, and then using our staff for that, then actually we'll end up being in a worse situation and might increase the risk of burnout and with the duplication of work. And last 2 points being improved decision making and productivity. So self-reportedly, doctors using the AI systems report felt that they were better in their productivity and had mixed views on over-reliance and accuracy of AI, with quite a few responses being quite confident in that if I've been using AI often, I'm confident in actually saying, no, if the AI said this is a differential diagnosis and my clinical expertise overrules it, I'm happy to overrule it. But the last point, and this is where we go into our key themes, is that actually the worries have come about already from professionals looking at responsibility and liability. So without there being enough of the kind of the regulatory aspect of it, the cautious optimism is quite worrying for those looking at it. Now, in terms of the work that we've done and the perspectives conversations, I'm quite wary of time, and we need to have a good Q&A session. So I'm just going to try wrap up in the next few minutes. These are the key themes that have been heavily focused around the distinct issues around regulation or lack of it in the space, especially for AI and GP. And you can see there's quite a focus on ideas of improvement as well. So just running through it, there's been quite an emphasis of a challenge for us and regulators of trying to balance the rapid technological advancement with robust oversight. And how, for us, we need to make sure that we can encourage innovation whilst ensuring safety. And that's where regulation and governance is key. We're lagging behind with the advancements. We need to catch up. There's actually been calls from ICBs for high-level guiding principles instead of restrictive frameworks to support AI innovation. And that's where organizations like NICE and ORCA can come in with also recommendations. And as mentioned, there's a lack of standardized regulatory frameworks out there, with gaps in oversight for non-medical devices and administration, or even patient triage, that aren't regulated under the MHRA. So, for example, HIDE AI is an administrative tool, so even though they're used in clinical practice, they don't count as needing to go through MHRA approval at the moment. And finally, looking at governance, data governance, concerns were raised about data being processed, how it's anonymized. I can't say that. GPs and GPs as data controllers. The second part being safety and mitigation, risk mitigation. We're looking at ensuring patient safety to be paramount. We need AI tools that require regular monitoring, auditing, and quality assurance processes to ensure they're safe and effective. Just like any tool in GP, QI needs to be applied to these devices, and sample checks of, let's say, 5% of patient cases, compare the doctor transcribing it, compare it to the ambient technology or the differential diagnosis systems that are being used. And actually what we've found is that many GPs lack the training or governance of AI tools because there's not enough out there at the moment, leaving them vulnerable to those errors and compliance risks. And one suggestion has been at the moment is a checklist to ensure a safe procurement and ongoing use of AI would be quite useful to those in general practice. Liability and responsibility, we've come across this. The questions are, who's responsible when things go wrong? Is it the AI device companies? Is it their underlying algorithms? Is it the general practitioner or the clinical pharmacist that's using the technology there and having the final oversight? And medical indemnity. At the moment, from our knowledge, medical indemnity does not cover these data breaches and instances like this. Number four, we're looking at training. So there's a distinct need for training on digital and clinical safety for all roles, and there's not been enough out there in terms of NHS England or GMC, and clinical safety officers in the interim need to play a pivotal role in training and oversight of AI tools in practices. And what the problems are that we're seeing is that GPs don't know what questions to even ask at procurement or the principles for regulation or implementation, and that's where they need help. And we're getting quite vocally people asking us for help with that now. And clearly, this is where regulation needs to step in. Now, the role of us as the CQC, we need to ask critical questions and provide key guidance because we're out there, we're out there inspecting and and seeing what's being used in the front lines. So what we've been asked of is to ask high-level questions about AI use, provide support and safe implementation, compliance frameworks, and most importantly, to ensure that AI does not disadvantage the most vulnerable groups and health inequalities aren't exacerbated. And that's one of the key points that has come up again and again. Collaboration, as we've mentioned as well, cross-body efforts that we're trying to push for at the moment. And everyone in terms of stakeholders we've spoken to have been very positive, open, and quite keen because AI is the buzzword of 2024 and 25. Everyone wants to be involved and everyone wants to have their say in shaping regulation and standards. So we've got the buy-in, but we need to kind of lease up our free time and resources to make sure that we can do that. Procurement and implementation, as mentioned, GP practices and are making those decisions at the moment with a very minimal guidance. So then you end up having three tiers of GPs. You've got the people that are early adopters, you've got people that are complete skeptics and will say no to it. You've got people in the middle that might be like, actually, the practice next door has it. Anecdotally, they're doing well. Should we just get involved? And then sales reps, speaking to sales reps instead of looking at the data behind, because we don't have any long-term evidence or use or research of AI models. And actually, do we know what data is being used by these AI devices and what they're going through? Is it made up data? Is it real world data? How are we supposed to kind of find the middle ground between the two? And this is where regulation needs to step in, and the disconnect between GPs and ICB is quite apparent. So this is something that we'll be talking about in the next few months coming up. And mentioned already, we don't want to exacerbate those inequalities for patient populations. And of course, there are loads of ways that AI can be harnessed to improve or close that gap in terms of healthcare inequalities, and there's loads of work out there. And Jeff can even mention how University of Birmingham and NIHR research is looking into that and looking at work into it. But we need to be advocates for this, especially as the CQC looking at those who are most vulnerable in terms of population. Brilliant. This is just for something we can give it as homework. BMA have come up with their own principles of AI that they think should be applied, and that was quite an interesting read. Definitely, most of the key themes that we've already spoken about from perspectives of stakeholders have actually come up in that as well. And now finally, what we're going to do is take your perspectives. So we've got about 15 minutes left, and I'm sure Jeff will come in at any time. So what I'm going to do is we're going to poll your perspectives of, have you used AI in your role before? Yes, non-healthcare. Yes, meaning healthcare. No, you've not used it before. And then what we're going to do is then go to the Q&A and discussion, and we'll have you can type your answers on there, on the Zoom comments as well. And obviously, if there's any way that we can get mics involved, we'll try our best to. If we don't have enough time to address all your questions and comments, I'm more than happy to take things offline, and I'll respond when we can as well. Brilliant.
Brilliant. Thanks for such an engaging talk, Taf, for insight into such a great program of work too.
Thank you, Jeff.
I'm sure there'll be some questions trickling in, and I would really encourage that, even if you feel like there's a list there. Like I say, we will note them down, and we may be able, even offline, to come back to them. But just to kick off, I might just ask if, and I appreciate you're only partway through this, but
Yeah.
you mentioned people sort of self-reporting a sense of increased productivity,
Yeah.
but also those challenges of evidence to support the kind of value proposition of these tools. Have you tripped across any sort of examples of QI or kind of evidence generation of the value back from these tools?
So that's a great question. And at the moment, we haven't spoken to the GP practices, but from the word on the ground is that no one's really been looking at QI yet. One of the reasons may be that it's really early on. So if the AI was deployed only 4 or 5 months ago, they might be having an idea of using QI further down the line, maybe 6 months or 1 year mark. However, we've not got any data from that. There's nothing on the research in terms of evaluation as AI is being deployed to see that actually are there any metrics to show is that GP being more effective utilizing this scribe, or actually were they already effective without the scribe? And actually having those conversations on the front line with colleagues and friends who are in general practice, and some are quite skeptical. Those that haven't used it, they go, "What's going to happen if I increase my time in seeing my patient into a 10-minute block? Will I end up having 5 minutes instead? And then what's going to happen in terms of the flip side if we become too good with it as well?" So no, not enough reports at the moment regarding QI and evaluation. And hopefully, this is our way of identifying those issues and trying to make sure that that is there, just like for any other devices.
No, that's great. And I think it's a great value of the work you're doing, when the sort of publications and those kind of data aren't out there, just as a bit of a
Yeah.
on the ground information is super helpful.
Great question. Thanks, Jeff.
I'm going to come to Karen Wallace next, if that's okay. Thank you very much for dropping a couple of questions there in the chat. I'm going to try to unmute you. If it doesn't work out or you're not in a place that you can speak, I'll try and do you justice myself. But I'll just try and unmute you there.
Hello, Karen.
Oh,
Hi, Karen.
can you hear me?
Yeah. All good.
Oh, great. Oh, I thought that it had been blocked and tech had failed us. Hi, thank you for the great chat. Two things really. I was just wondering when you thought professional bodies will bring out some guidance for healthcare professionals, not just with their patient work, but with appraisals, revalidation. There seems to be no guidance on that yet. I was just wondering what your thoughts were on it.
Thank you for the question, Karen. And your background is what exactly? I just wanted to check.
No, sorry. A GP and then occupational medicine, and then I'm a responsible officer, but head of clinical innovation for a private company for Maximus.
Brilliant.
Yeah.
So you tick a lot of the hats off for AI use in practice.
That's a classic doctor, right? Lots of hats.
No, brilliant. And so, Karen, from what I had seen, there was some guidance from the RCGP regarding their awareness of people
Yes.
using AI for reflection, and actually saying that there's no way that they can stop that from happening. They did stop short of saying what their stance is regarding use
Yeah.
in actual patient cases, and obviously you mentioned here case reports that's already being used. People are
Yeah.
aware of it,
Yes.
and no proper guidance there. However, when speaking to the board members of RCGP, they are working on things right now. I think towards the summertime, they're hoping to kind of come out with data and research. Don't hold me to that because I don't know what their timelines are just yet. But they are working on it, but nothing just yet. But from Google, RCGP guidance for reflections in portfolio, there is a piece written by them, and maybe you can see some of those standards. I hope that's a little bit.
No, great.
Yeah.
Perfect.
What are your thoughts on it? Do you think GPs should be using?
So I'm a responsible officer for the GMC, so we haven't brought out guidance yet, and it's something that I've kind of raised, but they feel like it should fall back into organizational policies to manage that. My thoughts are if it's prompted well and it shows true reflection, so it's input and it's personalized, I don't see why not. So
That's quite interesting. I mean, the scope of even using AI software within the RCGP portfolio, I think there's different.
interesting. Yeah.
Not something that they've spoken about, but I presume that's where these platforms are going to go because, as you've seen, every website's got an AI tool associated to it now. So portfolio systems probably will, if not already.
Perfect.
All right. Thank you for your question, Karen.
Thank you.
Thanks both for that. That's brilliant. And just getting on through the questions. Next, can I bring in Laura Lewis? I'll just try and do some unmuting. Hopefully that works for you, Laura.
Oh, has that worked?
Hi,
Yeah,
Laura.
that's brilliant. Thank you.
Brilliant. Yes, I was just wondering, it's evolving so quickly. I was just wondering if from any of the preliminary discussions with stakeholders, whether there's any desire for kind of a pause and a safe space to have that sort of philosophical conversation about what we're embarking upon and you know, the risk and the speed of change, despite all the great opportunities this has to offer us.
That's a great question, Laura. You, for us in this space specifically, what's your background, Laura, and how are you involved in it as well? Before I answer.
I'm in NHS England, in the southwest region.
Nice.
And we've just recently set up a primary care laboratory, which is looking at ambient voice technology in a sort of safe offline environment, appreciating that it's already out there.
Yeah.
But yeah.
I think to answer your question is no, people haven't taken that time out to think about the principles of AI because it's being utilized already, and we're all in regulation quite openly playing catch up, and it's been actually very tricky because with a technology like AI and everyone being so excited about it, there's not as much appetite that I originally thought before going on with this, of people looking at regulation and dampening kind of the response to it. However, when speaking to people on the grounds and bodies, kind of regulatory bodies as well as providers, people do want things in place as well in terms of guidance, principles, things that don't restrict but enable, and then something to have a look at. Now, that means that we just need to turn out the work on that, and rather than pausing anything, because it's not being paused in GP practices, we kind of are having to try and just catch up more than anything else. So I hope that answers your question to an extent. The answer is basically no, not enough of us have actually taken a step back and the potential use cases of it. But having projects like this and research out there of actually using an AI scribe, is it useful compared to using a normal other digital device like a dictaphone? These are the zeros and one cases that the conversations we're having in these stakeholder meetings. So at least there's awareness of that at the moment, Laura. Yeah.
Great, thank you. Such a good presentation.
Thank you, Laura.
Thanks very much. Next, I'm going to come to Mez Hakim. So I'm just going to unmute you, Mez.
Hi, Mez.
Hey, hi Tafsir. I want to say thank you so much for that presentation. It was really interesting for me as well, being, I guess, earlier on in my career. I kind of alluded to it, but being at medical school currently, it's been interesting coming post-pandemic to have kind of how you conduct both in-person and virtual/telephone appointments. Do you think we can see like the use of AI in appointments being introduced into medical school?
That's a very topical question, especially when you look at bodies such as the GMC who are in charge of medical curriculums as well, as your medical schools. I think yes, it's going towards that aspect. The reason why that's been maybe not utilized as much in terms of digital health in general practice and video conferencing is maybe because of the user experience being negative over the COVID time period. However, that was quite a rushed response and use, and there wasn't enough buy-in from the patients maybe at that time from the reports out there. So I think we will end up going towards it, especially if the whole interface is digital health and AI based already, and it'll be good to use communication skills on a telemed platform, and we might be looking at OSCEs actually getting you to do these virtually, because that's an aspect of it as well. In medical schools curriculums, before the medical school curriculum, when you go into interviews, a lot of interviews actually happened over COVID virtually as well, and that was interesting because that's a whole cohort of potential doctors, medics coming through, needing to kind of build on those experiences and skills that are very different to in-person ones. But yeah, thank you very much for your question, Mez. I hope I've answered it.
Thanks both. I think thanks to the clock, we're probably coming around to our final question, but great discussion. Thank you. And thanks to for all those extra questions and some comments highlighting risks and other things. We'll be sure to take note of those. I just wanted to bring in Trisha Jayabalasingham. I'm going to try and unmute you. Hopefully, things seem to be working well so far. So over to you.
Hiya. Hi, Taf.
Hey Trisha, how are you?
I'm good, thank you. So I'm Trisha. I'm a clinical fellow at NHS England, working in the patient safety team. I'm probably quite sort of inexperienced with AI. I think I've used Chat GPT once or twice in the past, but sometimes I feel like we see it as a kind of one entity, whereas when I consider its different use cases and the risks associated with those, I think there's probably differences of approach that are necessary. So the example I've used in my question is something like ambient AI being used to summarize notes is probably a relatively safe piece of technology to use versus something that might be interpreting or making diagnoses on scans. And I wondered if you think a more nuanced approach needs to be taken from a regulatory perspective.
Is that regarding the administrative tool specifically, or just in terms of AI in general?
Yeah, in terms of the fact that we sort of see it as one entity, and it strikes me as that's how regulators and policymakers are seeing it. Do you think we need a slightly more sort of detailed or broken down analysis of it?
I think you're 100% right. We do. Speaking to MHRA colleagues, they're stretched as it is within their teams looking at AI technology amongst other digital health technologies coming in, and they haven't been able to, and we as a collective haven't been able to put our resources there. The difficulty is there's always question, even for the definition of AI, there's huge discussion regarding that constantly. It's where you can put those lines and whether that AI systems, those systems are fluid. And as more are being developed, the more categories we're seeing, just as the few that we'd already gone through in the presentation. So yeah, there will be probably work there and is needed, but it will probably come as more and more of these technologies flood into the market, I guess. Thanks for your question, Trish.
Thanks, Taf.
Brilliant. Well, thanks so much, Taf, and thank you everybody for joining us. It's been a fantastic presentation, great conversation. I really appreciate it, and the extra questions as mentioned. The last thing for me to do is just highlight what's coming up next. We've already had a sneak preview through the question from Laura Lewis, Head of Digital Technology at NHSE Southwest. So we're lucky to have Laura joining us as well on Thursday, 13th of Feb, 4 p.m. To speak a little about the work she has, perhaps the lab she mentioned, but also the collaborative procurement in primary care of an AI tool in the Southwest, which would be great. So thanks again for joining us, everybody. Thank you, Taf, for your time and fantastic insights. And we look forward to keeping the conversation going. Good evening, everybody.
Good evening. Bye, guys.